Good day. My name is Raquel Hatulan. I am a second-year nursing student from Section 12A of Davao Doctors College. In this video, I am going to show you the Leopold'S maneuver. The first thing that we are going to do is perform hand washing to deter the spread of microorganisms. Next is we're going to explain the procedure to our client to gain the patient's cooperation. Good day, ma'am. My name is Raquel Hatulan. I will be your student nurse for today. Our procedure is called Leopold'S maneuver. Leopold'S maneuver is a method of observation and palpation to determine the fetal position and fetal presentation. Next is we'll let our patient empty her bladder before the procedure. We do this because a distended bladder may deviate the uterus. Ma'am, before po the procedure, ma'am, I'm going to ask you to urinate so that later during the procedure, there will be no problems or any disturbance. Assuming that my patient has already urinated, it is time for her to assist her in a supine position on the patient's bed. Ma'am, we are going to the bed na po, ma'am, ha? And please lie down on the bed, ma'am. So, it is important to remember to insert one pillow under her head. Flex her knees. So, we do this to provide comfort and also ease the tension on the abdominal musculature. Next is I am going to stand on the right side of the patient because I am right-handed. And later when we do the third maneuver, it will be easy for me to place my hand on the symphysis pubis. Next is we are going to face the patient, palpate the uterine fundus. So, we do this to determine if the fetal head or the fetal breech is on the upper parts of the uterus. Okay. Next is, in a downward movement, we are going to palpate the sides. So we do this to determine the fetal extremities, the fetal back, and anterior shoulder. Next is, I will place my right hand on the symphysis pubis. So, I am going to grasp the lower uterine segment between my thumb and the fingers. So, we do this to determine the presenting part and if engagement has occurred. Next is I'm going to face the feet of the patient. So, what I'm going to do next is the fourth maneuver, which is the pelvic grip. We do this to confirm our findings during the third maneuver and also to determine the flexion of the vertex. Okay, so after this, we are going to locate the fetal back once again. Using that, because we are going to listen to the heart rate. So using that is the stethoscope, and also we are going to do that in a 1 full minute. Okay. Okay. So we're going to count in a 1 full minute. Also, by doing that, we have to note the location, the character, and the rate of the fetal heart tone so that we can see if the fetal heart tone is within the normal beating pattern. Okay, so our procedure is done. Now, we provide comfort to our patient. We do this to promote relaxation and to ease the tension. Okay, ma'am. So, our procedure is done na po, ma'am, ha? I'm going to pull down your shirt. Also, ma'am, relax yourself, ma'am, ha? Okay, ma'am, take all the time that you need, ma'am. Okay. And the last thing that we are going to do here is to document our observation. We are going to document the fetal presentation, the position, the attitude, and whether it's engaged or floating. So we do this to promote database for future and also to support multidisciplinary team to deliver great care.